investigations have been done in the field of laser-supported endodontical treatment to see what is going to happen in the root canal, how much energy is transmitted, what temperature are existing, and most important was the answer of the microbiological study. Are we able to destroy microorganisms not only in the main canal, where we can do it also chemically, but especially in the lateral dental tubes? That was a very important question. And of course, we have been investigating how it is possible to go and to use now this method in a long-term study, a follow-up study of 5 years, to see how big and how good our success rate is. So also long-term clinical studies have been done, and these studies have been done with a very clear treatment concept, and as you can see here, the treatment concept which we have established is including, of course, all the conventional treatment, as you can see it, and after the conventional treatment is completed before filling the root canals, and or in between, we are using wavelengths, either combining Erbium-YAG and ND-YAG or only ND-YAG lasers, in order to clear and to remove and to destroy all the microorganisms in the root canal system. So, as I mentioned, we have, of course, to fulfill our duties with the mechanical enlargement of the root canal. Still, we have to do it because we cannot insert a glass fiber in the canal which is not having at least a size of ISO 30, because the fiber is 200 micrometer. And whatever system you are using, I'm preferring the crown down technique, then you have a very nice root canal shape in order now to insert your laser in order to destroy the bacteria which are beside. This is why then you are using a laser with a very specific setting. You are adjusting the laser fiber according to the root canal length. You have settings which have been researched over many years, and you have also an application time and mode which should be followed also according to our investigations and researches. And then, of course, we can be nicely confronted with cases like this, where normally a long time of pre-treatment was done in a conventional way. The patient has been referred to our university clinic because there was no solution. The resorption and the destruction was ongoing. There was even a fistula canal coming on. So we have used our conventional combined now with the laser treatment, going with the laser into the root canals and into the fistula canals. And when we are looking at the clinical results, that is the initial situation when the patient appeared. Then 2 months later, and as you can see here, one of the big reasons was an internal resorption in the apical third, which was almost penetrating, or which was penetrating to the periodontal ligament. This is why the conventional treatment was not successful. But using a laser down here, we could destroy all the microorganisms. We also have a biostimulation for a new bone application. And as you can see already 7 months later, how nicely the improvement is. We have a complete new periodontal ligament here, a very nice bone structure, and 1.5 years later, you can see even the bone structure here. This tooth is completely strong again, and everything has healed in a very nice way. So a tooth which was lost, which should have been removed, or another surgical intervention, was nicely saved in this way. Similar, I will only show you, I will not explain every case, but also here you can see also this was pre-treated for more than 6 months. The laser treatment was done, and this is 6 months after the laser treatment. You can see again a very wonderful situation because all the microorganisms have been destroyed in areas where you normally cannot reach. This is a cystical formation also with the fistula canal. Using, again, conventional treatment just to maintain this information to you, using the laser then in the root canal, and you see the situation before in this part, and just 6 months later, also in such a severe case where there was a fistula canal combined with a cystic formation in this area, we could gain with 3 laser treatments a very nice reconstruction of the tissue, periodontal ligament is repaired, and the reossification has taken place in a very nice way within just 6 months of time. And also the clinical picture with the fistula canal, and after 4 weeks of treatment, already the clinical situation outside was completely healed. Then another area which is very nice is the laser supported closed curettage using diode laser and NDR laser, or the laser supported open curettage. Again, here in this way we are using lasers, but as you see here, now an urban yak laser in order to clean and unify the root structure, the bone, the interbonal defects to be cleaned out with the laser in a very nice way, because we have a high bactericidal effect. In the same time, we can remove the tissue in a way which is extraordinary, and we have a very good situation to place bone regeneration material or bone transplantation materials in order to get a nice regeneration done. So again, here it's a combination between conventional treatment and laser treatment. Thinking about the closed curettage, we have understood again different wavelengths. Now in the periodontal pocket, where we have on the one hand side the hard tissue, enamel dental cementum, on the other hand we have the soft tissue section. We are using lasers like an NDR laser, which is not absorbed in this part, which will not destroy the hard tissue, but which will destroy all the pigmented bacteria, which will remove the infected tissue in a very nice way, which was proven in a lot of studies, as you can see them here, from the university, from the Columbia University in New York, from other parts around the world, from UCSF, San Francisco, from our own studies, how to use the laser in closed curettage, vaporization of infected tissue, reduction of subgingival microflora, then selective elimination of melanin-producing bacteria, Marshmitter from the United Kingdom, and then delayed pocket recolonization and high efficiency in the reduction of subgingival flora. Also very important studies done by different researchers from the US. And as you can see here, this was one study we have done together, Aachen and the University of Texas, for the approval of NDR lasers in closed curettage for the FDA, Food and Drug Administration. You can see the control group, the conventional treatment group, the laser group, always the green line. For Prof. nivalis and Promotella intermedia, we have significant better results in the bacterial reduction. And one of the most impressive parts for all of us was that especially AA, actinomyces actinocommutans, has been reduced to a very high amount here in the laser-supported group by the laser treatment. So we can see using additional laser to the conventional treatment will give us a much higher treatment success, and I think that is not only good for you, but it's especially good for our patients. And of course, we are combining the conventional treatment, and then we have special settings to use the laser in the outside, to go into the periodontal pockets, and already after 1 week and 3 weeks you can see a huge and nice improvement. What is also seen in these situations in a very nice follow-up, how the periodontal tissues are healing and how good the reaction is, and patients, they will just follow and see themselves. Also the bleeding on probing, the pocket depth, very good progress. I don't place now all the factors because of our time limitation. Now, in soft tissue surgery, we can say with lasers we have an ability to work without sutures and bloodless. Yeah? Using CO2, low pulse urban yak lasers, diode or NDR lasers. As you can see here, for this frenectomy, the laser was used, and only after 2 weeks you see a scar-free, wonderful healing without any side effects. Or using an NDR laser, just to demonstrate, you are doing a complete blood-free, no bleeding at all in this way, and again a wonderful healing process. also after 2 weeks taken to see the complete healing, 10 days actually exactly. And you see you can work in a way which is completely different to the conventional way. This treatment takes me maybe 3 to 4 minutes only, the complete treatment. And if we know how this treatment has to be done for an oral surgeon, I think among you here there are oral surgeons, it is not a task of 3 to 4 minutes, at least if you are very fast, 10 to 15 minutes. And you have a bleeding, and then you have to be experienced as well. And if you know the technology, the technique of using a laser, you can get very nice results. But also, heart tissue treatment. Very promising and a very nice part using urban yak lasers. In this part, I will show you now a combination of a patient. This lady had a big abscess, and the abscess incision was done with an yak laser, which has a high coagulation, as you have seen, bloodless cut. So the pus is only coming out, no blood at all. We have a very nice healing process, and without any scars. And on the other hand, this was the situation. We had to do a surgical treatment because the root canals were completely obliterated. That was the reason for the abscess. And as you can see here, when I'm treating now here these roots, you can see the apicectomy is done with the laser in such a precise way that you're not harming the bone, which is covering your root. As you can see here, the cut is done in a very nice and a very precise way. So we have also a very good and wonderful post-operative healing, especially because we can clean out the areas in a way which is normally not possible with conventional instruments. On the other hand, of course, also exposing implants, urban yak and CO2 lasers are wonderful lasers. As you can see here, this patient has been having some implants placed before, and now the exposition has to be done. That was one of my master students. That was his clinical case presentation as he has done it, and you can see how nice with an urban yak laser you're opening up these areas of implants without any bleeding in a very precise way. And as well also here to have a tool now, a very modern tool for us for peri-implantitis treatment. Again, another clinical case of one other master student of mine. I'm just showing you these cases that you can see it's not only Gutknecht in Aachen who can use a laser. My postgraduate students who have completed their master studies or mastership studies, they have to show and to present their cases after their studies. And they have done very wonderful cases. Another nice case to be treated with peri-implantitis with laser from Professor Norbert. At that time he was working still at the University of Frankfurt. Today he's in the University of Rochester. And his treatment process in these parts done the exposure now using a CO2 laser, and then the follow-ups from the initial situation and then after laser treatment. I think it is a very nice and a very promising part to know how we can save implant constructions, yeah, in order to go on to clean out all these infected parts, that we can clean the surface of the implants with the laser without harming the surface, but using, of course, an urban yak laser, placing our own regeneration material and closing up. This is a very, very promising indication. And I have to tell you, I know that many of us dentists are very much focused now on the new market, not the new market, but the very fast growing market of implants. But we know also in this area, a lot of colleagues have not enough experience. They just place the implants. Maybe there's not a good pre-diagnosis. And so a lot of cases are coming back now to us. My department is also the department of periodontology. And we are treating all these peri-implantitis cases due to maybe different reasons. I don't want to discuss the reasons now. Last but not least, what is possible with lasers in the field of cardiology and cavity preparation. We have to say, we are very happy and very proud that with the laser, due to the biophysical interactions, we can remove selectively caries without removing more sound and healthy material. That is also why the FDA clearance was given already in 1997 for caries removal, cavity preparation, and for the modification of dentin and enamel before acid etching for increased bond strength.